My name is Vincent DeCunto, and I'm here alongside my research partners, Andy Akdamir, Diane Hadavi, and Thomas Herman. We're going to be discussing our research study, changes on subacromial space during active-passive scapular corrections. So our subjects were all from Dominican University. They were mostly DP2 students, cohorts 2023 to 2025. Researchers, members, families also participated in our study. We had 38 participants total. 36 were right-hand dominant, whereas two were left-hand dominant. 10 males, 28 females. And all of our subjects had no history of neck or shoulder pain within the last 6 months. And they were all recruited via email and word of mouth. As far as our methods, we took measurements of the subacromial space using real-time ultrasound at 0, 45, 60, and 75 degrees of active shoulder abduction without any cueing. Then we decided to take measurements at 45, 60, and 75 degrees shoulder abduction with both the scapular assist test and verbal cueing. The order of the scapular assist test and the verbal cueing were switched and randomized for each participant. So the strengths of our studies, we believe, were one, that it was a quick, non-invasive study. We used reliable and valid new equipment, such as the Malak Easy Angle Digital Gomiometer and the Flex Focus 400 by BK Medical, which is real-time ultrasound unit. Measurements were taken at 3 different angles of shoulder abduction, which transitions to functional activity, especially with overhead activities. It accounts for that change in subacromial space that occurs. The instructions were explained in an identical manner to each participant, which is also very important. And this was a novel study that studied the effects of active versus passive scapular cueing in relation to subacromial space.
Primary weakness of our study was lack of training and expertise on ultrasound. We measured subacromial space based on our anatomy knowledge, and we did not have access to ultrasound expert to confirm that we measured it correctly and we are on the right spot. And this can be one of our biggest study limitation. Our second weakness is our inclusion criteria, which was only healthy adults, and we did not do this study on patients with shoulder impingement, with their scapular or motor control problem. Our study is a good model and starting point for the future researchers to apply the concepts on the subjects with shoulder impingement. Our third weakness was about our convenient sampling, and that most of participants are PT students and learn the Q in the PT program, and might affect our study quality and decrease generalization of our study result. Lastly, our sample size is relatively small, includes 38 subjects, and we had only 2 left-handed participants.
So we have had a few opportunities throughout our process in this research study. First and foremost, we were guided by our mentors, Dr. Deere, Dr. Rodriguez, and Dr. Rush, who were nice enough to help us out in this entire process. We were using new real-time ultrasound equipment, which was provided to us by Dominican University. And while we were not trained in this, we utilized research journals, YouTube videos, mentorship from Dr. Deere, and other resources to help determine proper techniques in using this new piece of equipment. Another opportunity is that this is novel research, which is performed in healthy subjects, which then can be used in the future to guide research for those with subacromial impingement or potential scapular maltracking. And finally, there's opportunities available to us if we would like to become certified in real-time ultrasound, and we can use this in a clinical setting to help guide us in diagnostically imaging our patients.
Lastly, due to the design of our study, there are little to no threats that occurred during our actual study, and there are very relatively low level of potential threats that could have occurred. These include an allergic reaction to the ultrasound gel, any type of pain, discomfort, or injury caused by either excessive force when performing the scapular assistance test or when pressing down with the ultrasound head, as well as leaking of participants' personal information. And like I said, while we didn't experience any of this, these are potential threats that could have occurred or can occur in future reproductions of this study. Outside threats, kind of how I just touched upon, reproduction of this study in an unsafe manner, because this was kind of a pilot study. Anyone who tries to reproduce it may have some sort of issues reproducing in the same safe way. And lastly, generalization of the results to populations other than healthy adults. Because the study was performed on healthy adults, we're not exactly sure what the outcomes are going to be on patients with either shoulder pathologies or dysfunctions of the upper extremity. lastly, we just want to thank all of our mentors as well as Dr. Adir. And we give Dr. Adir permission to use this presentation for educational purposes in Research One course material.